So SIBO is a condition that's characterized by an abnormal increase in bacterial populations in the small intestines. This is an area that we normally don't have bacteria. Normally we shouldn't expect to see bacteria in the small intestines, but when we do, this can cause a variety of gastrointestinal symptoms as well as systemic problems throughout the body. And so while proper treatment often brings significant relief, unfortunately for the overwhelming majority of people with SIBO, they often experience frequent relapses, and that's despite how many rounds of rifaximin they take. And so understanding the underlying root causes of why this SIBO relapses and preventing it becomes effective and important for managing this and from preventing it from ever coming back. I'm Dr. Hagmeyer. I work with patients all over the United States and many different countries around the world. Many of these patients suffer with SIBO, but other gut-related problems. And I bet if you're watching this video today, then you too are probably frustrated. The fact of the matter is that there's not a single day that goes by where a new patient doesn't reach out to my clinic sharing their frustrations of SIBO treatment and the fact that it's come back, and it's come back 2, 3, 4 times. So in today's video, I want to highlight some of the reasons this SIBO returns and some of the strategies that you can implement, and maybe by the end of this video, you'll pick up 3 or 4 or 5 things that will help you overcome this. So here are 7 common reasons why SIBO often reoccurs. And number 1 really has to do with something known as biofilms or biofilm disruptors. Now, I mentioned this before, and I recently did a video on some of the SIBO biofilm disruptors that I use in my practice. So if you haven't seen that video, I do recommend that you go back and you watch that either on my website or on this channel. But when it comes to SIBO, there seems to be this misnotion that antibiotics or antimicrobials are really just enough for the treatment of SIBO, right? Here's the fact. Most bacteria produce biofilms. And if these biofilms are not broken down, you're not going to get complete eradication of it. And that's going to lead to the relapse. Some bacteria, as well as yeast, they're just incredibly resilient. And if your immune system is compromised in any way, shape, or form, and you don't use biofilm disruptors alongside your antimicrobial or antifungal, you're going to have a high percentage of those bacteria that survive. Now, these bacteria that survive, these are called persister cells. And these persister cells now just repopulate the small intestine, causing a reoccurrence within 3 to 6 months. And that often happens, down the road. That's problem number 1, not using a biofilm disruptor alongside your antimicrobial or your antifungal. Okay, so problem number 2 has to do with motility, right? Another significant factor is motility issues within the small intestine. Remember that SIBO is not just an overgrowth, it's first and foremost is a motility disorder that allows the bacteria to overgrow to take place in the first place. This is why motility, using motility agents like prokinetics are really, really important. Normal intestinal motility involves muscular contractions within the stomach and the digestive tract to move food and toxins and dead cells and bacteria out of the digestive tract. It's really one of the ways the body cleanses the contents of the stomach. And when these movements are impaired or slowed down, as seen in conditions like irritable bowel syndrome or celiac disease or Crohn's disease or some sort of damage to the migrating motor complex, those bacteria can stagnate and they can multiply excessively. This is why it's so important to use prokinetic agents, and it's important to do vagus nerve exercises a few times a day when you have either small intestinal bacterial overgrowth or small intestinal fungal overgrowth. Now, the vagus nerve is part of the parasympathetic nerve system, and it's the major nerve system that really regulates all digestive function. So enzymes, gallbladder, liver, stomach, small intestines, large intestines, the parasympathetic nerve system regulates all that. Okay, so number 3 on my list of reasons SIBO relapse occurs at such high rates has to do with the low FODMAP diet. Now, I know this has been talked about so much, but here's the thing. There's really 4 major mistakes that I see people making when it comes to a low FODMAP diet. Some people have been on a low FODMAP diet too long. Some people have not done it long enough. Some people cheat on weekends when they need to be super restrictive. And some people, despite following diet perfectly, doing everything the way they should, they unknowingly have a food allergy or a food sensitivity to the very foods that are considered low FODMAPs. So let me speak to each of these mistakes a little bit. Now, before you say, how long do I need to be on a low FODMAP diet? Really, I don't know. I don't have a magical time limit for you. Really, this depends on a lot of different factors, and it really comes down to your test results and other health challenges that you might have and the clinical experience of your doctor. It's a judgment call in some cases. Now, if you have an autoimmune disease, that could be a potential reason. If you're diabetic, if you have a fatty liver, if you have a celiac disease, if you're a smoker, if you're a recovering alcoholic, if you've had surgery, if you're taking medications or what kind of medications, I could probably list another 20 different reasons. We're all different. And here's where, again, your treating doctor can hopefully guide you with their experience for the best measures as it relates to that. But here's the thing, without knowing any of this, I really can't tell you how long you need to follow any diet for. What I do is I retest the patient, and if their symptoms are 90% better and testing shows that there's improvement, then I'm comfortable with, then we start to incorporate FODMAPs back into the diet. But again, this varies from person to person. Here's something I just want to say. Diet plays an important role when it comes to SIBO, but I think sometimes it overshadows and I think it even marginalizes all the other areas that are required for a successful treatment to work. I see so many people following a low FODMAP diet perfectly for 3 months and they see zero improvement. Did the diet fail them? And the answer is no, not at all, but they were missing all these other things that I talk about on this channel and on my website. But as far as diet goes, there is no denying that diet, or I should say a diet high in fermentable carbohydrates, these FODMAPs, can feed bacterial overgrowth, and that can exacerbate many of the symptoms, and that in and of itself can contribute to a relapse. But there is a fine line between avoiding them too long, whereby you start to cause damage and harm to the microbiome in the long run, and cheating every Friday night when it's happy hour, all right? We need to understand that FODMAPs for long-term gut health, they're needed, and avoiding them too long is another major mistake when it comes to treatment for SIBO. Now, if you've done a functional stool test and your microbiome has been just wiped out, I don't typically recommend a patient following a low FODMAP diet. In situations like this, in my experience, you may need to rebuild your microbiome before you start tackling it and nuking it with antimicrobials and antibiotics and antifungals and more low FODMAP dieting. And so that brings me to the next point about diet. Some of you are making the mistake of just cheating too much and too often. Think of it this way. If you know anything about sourdough bread making, you know that you start out with this yeast starter and you feed the yeast starter, and within a few hours, the levels of yeast just begin to explode within that jar. It doubles, triples, quadruples in size. And after a day or two, what happens is the starter levels come down. They deflate. They just come down in time in the jar. Well, when you feed that starter again, what happens? The level doubles, triples, quadruples in size again. Every time you eat these high FODMAP foods, you just feed all the bacteria and the yeast in your gut. And this is why adopting a low FODMAP or a SIBO specific diet and sticking to it can help manage the overgrowth while you work on correcting as many of the other root causes that you need to deal with for your personal situation. Now, I routinely get patients who have been on a low FODMAP diet. They come to me and say, well, a low FODMAP diet doesn't work. And the reason it didn't work was for any of these reasons that I just mentioned. Okay, reason number 5 why SIBO relapse often comes down to the ileocecal valve. Now, the IC valve is a muscular flap that really just separates the large and the small intestines. And this muscular flap basically has both a sympathetic nerve innervation, but also has a parasympathetic nerve innervation. Now, normally, this ileocecal valve is closed. It prevents the backflow. And that's a good thing, right? We don't want toxic material moving in the wrong direction, right? And so again, here's where the vagus nerve is important because it activates the migrating motor complex. And this is why doing exercises that help stimulate the vagus nerve is helpful for motility and for people with SIBO. Now, the other thing to remember about the ileocecal valve is that when you are bloated all the time, this bloating prevents your ileocecal valve from closing. It kind of keeps it open. So if keeping the IC valve open, that's going to predispose you to bacteria entering back into the small intestines. And if you have bloating or you have ileocecal valve issues, those need to be worked on. And if that's the case, you also may benefit from taking hydrochloric acid enzymes. Now, I did a video called the IC valve release technique. I recommend that you go back, you watch that video. If you suspect that you have a problem with the IC valve, or if you have pain in the lower right side of your abdomen, if you have belching, if you have a lot of burping, if you have a lot of gurgling, and absolutely if you have, nonstop bloating. So number 6 on my list of reasons why SIBO continues to relapse for so many people has to do with underlying systemic health problems. These are things that I like to call outside the SIBO box, right? These aren't necessarily intestinal problems, but these could be things like thyroid problems. They could be like high cortisol levels or high stress hormones, food allergies, food sensitivities to low FODMAP foods. Could be leaky gut, could be pancreatic malabsorption. Again, some of those things obviously do have to do with digestive function, but overall, these again are things outside the box that do contribute to this bacterial overgrowth. Managing these systemic conditions through proper treatment is also going to be one of the things that significantly reduces the risk of SIBO relapse. Now, I often have patients who have not only have SIBO, but they usually have a metabolic and hormone problem. Things like hypothyroidism or Hashimoto's disease or estrogen dominance or diabetes. All of these have important connections to the gut and also ultimately to SIBO. Optimizing blood sugar control in the case of diabetics, or correcting high cortisol levels in the case of adrenal gland problems, or addressing and supporting the thyroid gland can establish a more favorable condition within the small intestines. Number 7 on my list of reasons for a SIBO relapse is your medications. Medications like antidepressants, antacids, anti-inflammatories, birth control pills, and medications for diabetes. I find that many of my patients are taking these medications these medications are contributing to their SIBO. So be sure that you investigate these medications by talking to your doctor and obviously having that conversation with them. Many medications, like I said, can create this intestinal dysbiosis, or they can actually even change the level of neurotransmitters that affect your gut motility. And specifically here, we're talking about those anti-anxiety and antidepressant medications. So as I wrap up this video, remember that SIBO is a complex, multifaceted condition. There are many cogs in the wheel that need to spin in the right direction. But if you know what those cogs are and why they're not turning, why they're stuck, that's going to be a major part in helping you get closer to preventing a relapse of your SIBO. Well, if you like today's video, be sure to check out some of the other videos that I've done on this channel in the SIBO playlist. And I also recommend that you head over to my website and read some of my latest health articles on SIBO as well. Till next time, I'm Dr. Hagmeyer. Take care.